Hello, my name is Carla Castillo-Payne, and along with my other researchers, Megan Bundy and Shameen Khan, we will be exploring sexual assault examination training amongst nursing staff. So what is sexual assault training, and do emergency medicine nurses need it? That's what we are trying to find out with our research project. Our PICO question is, how does being treated by a nurse trained in sexual assault as compared to being treated by a nurse not trained in sexual assault affect patient outcomes among women who are victims of sexual assault? So what is sexual assault training? It is a specialized training of registered nurses to be able to treat victims of sexual assault and collect forensic evidence from these victims. Here we have some statistics regarding sexual assault in the United States. Black et al. Found that in the US, 1 in 5 women and 1 in 71 men will be sexually assaulted at some point in their lifetime. Delgado et al. Found that only 34% of victims report their assault to authorities, and most rape victims will not seek medical care.
For research methods, we used EBSCOhost to conduct our literature review. In our search terms, we included sane nursing, rape, women, female, college, date, training, and forensic nursing. Excluded terms include pediatrics, children, infants, and male.
So Campbell et al. Did a systematic review of qualitative studies in which they reviewed 10 studies and looked at psychological, medical, legal, and community outcomes in patients that had been treated by sexually assault trained nurses. The results were inconclusive because some of their variables turned out to be affected in a positive way, while others showed no difference. Dumont et al. Conducted a quasi-experimental trial of ED staff where their intervention was perceived competence following training, and they looked at a 10-item questionnaire. The results were positive. It showed that training improved staff competence in caring for sexually assaulted patients. Conradi and DeBroom did a quasi-experimental trial where they hung up sane educational posters at Ohio University to see if these posters could increase the level of knowledge gained about sexual assault on college campuses. The result for this study was positive. Same posters and marketing tactics did inform university students about sexual assault on campus. Melkonian did a randomized controlled trial where they looked at alcohol consumption. This trial did not look specifically at sexual assault nurses, but it did look at time to detect unwanted sexual advances in a date rate vignette. The results were positive. So, women who had a blood alcohol level of 0.4% took longer to decide the aggressor's sexual advances were unwanted. McLaughlin et al. Did a quasi-experimental trial looking at 27 urban emergency medicine residents at a facility with an established sexual assault nurse examiner program. The variables looked at were trained versus non-trained emergency medicine residents, and they looked at whether the level of knowledge and training was different. So the results for this trial were positive. Because of the same standard training, the residents in the study improved in all areas that they looked at. Scannell et al. Did a quasi-experimental trial in an ED department in Boston, Massachusetts. They looked at whether a forensic course, training and stimulation, would change the time to administer HIV exposure meds. The results for this study were positive. Forensic trained nurses medicated sexually assaulted ED patients quicker than those who had not had the training. Sievers et al. Did a quasi-trial where they looked at trained versus non-trained sane nurses and physicians. And then they looked at the forensic evidence accuracy. In this study, the results were positive. Trained sane nurses were significantly more likely to produce forensically accurate evidence kits than those that were not trained. Finally, Vital study did a systematic review of descriptive or qualitative studies. Here, they looked at 23 participating forensic centers. They looked at the education and future changes to DNA processing methods and patient treatment. This study was inconclusive.
Dumont et al. Conducted a quasi-experimental study assessing 4 general statements regarding sexual assault. Researchers tested perceived competence in responding to victims or survivors of sexual assault prior to education on the topic. Post-education, researchers found that the emergency department staff's perceived competence and ability to define sexual assault increased. In understanding the different types of sexual assault increased, and awareness that sexual assault is mainly a gender-based crime increased. And finally, we're able to identify common myths about sexual assault confidently.
Campbell et al. Also conducted an empirical literature review, and here they did find that the effectiveness of sexual assault nurse examiner programs improved some patient outcomes, which we will discuss here. 97% of the SANE programs that they looked at did offer pregnancy testing. 97% said that they provided emergency contraception, and 90% did provide STD prophylaxis. Emergency contraception was more common in hospitals that had SANE trained nurses, 66 versus 87%. STD prophylaxis was also more routinely provided in SANE programs as compared to traditional hospital ED care. The percentage here goes from 89 to 97%.
There is also an extensive amount of training and costs associated with SANE training. Due to the sensitive nature of the topic, there is also a limited amount of research surrounding patient outcomes.
Limitations of studies. So the limitations of the studies that we did look at show that there were no randomized controlled trials for our specific PICO question. So most of the articles we found were qualitative in nature. Therefore, it was difficult to compare these articles to each other. So an ideal method for researching patient outcomes, specifically to our PICO question, is utilizing a randomized controlled trial where half of the participants would receive care from a sexual assault trained nurse and half of the participants would receive care from a non-sexual assault trained nurse. However, holding back access to specially trained nurses would be highly unethical.
Throughout our research, we would recommend continue researching sexual assault education for nurses and associated patient outcomes. We would also recommend observing short-term and long-term patient outcomes of SANE nursing care recipients. And emergency departments across the United States would benefit from further research supporting sexual assault nursing training. And that is the end of our presentation, and we thank you for listening. Here are our references.